is Dr. Omarine. I'm an ER physician in Texas, and I'm here to encourage those of us who work in the medical field to take better care of ourselves. So, if you work in the medical field or you know someone who works in the medical field, this message is for them, especially those of us who do shift work. So, this applies to those who work in nursing homes, rehab facilities, you may even be working in somebody's home or in the hospital. This is a story that happened 2 days ago, so it just happened last week. I am going to tell you the story, and then I'm going to give you just a few suggestions on how you can take the lessons from this story and apply it into your life, because my goal here is just to encourage all of us to take better care of ourselves. We give a lot to the medical field, so let us not take care of others and not take care of ourselves. So I'm going to call this lady Jane. Jane is a lady who is in her early 50s, and I've worked with her at the hospital for a few months. She has been in the hospital in the medical field, been a nurse for over 30 years. The hospital that we work in, the emergency room is very busy, and the patients are quite sick. They have a lot of medical problems. It is not uncommon to have a night where you have so many sick patients that you don't even have the time to sit down and eat anything. It is not uncommon to have patients who code, which means that they lose their pulse and have to be on life support or have to be emergently flown out to other bigger centers or have to be admitted in the ICU. So this is quite a busy hospital. I worked with Jane on Thursday night. So our shift starts at 7 p.m. ends at 7 a.m. in the morning. So I worked with her Thursday night, Friday night, and then on Saturday night I came in, and the first thing I asked was, where is Jane? Because Jane is the charge nurse, which means she's in charge of all the other nurses. And they said, well, Jane called in, they've called her, they've texted her, they didn't reach her. Come to find out, 2 hours later, her son calls us and says, Jane, she had gone shopping with someone, and they were in the store. She fainted, and they called the ambulance. They tried to resuscitate her. They even flew her to a different hospital. They didn't get her back. She didn't make it back. Jane was a very hardworking nurse. She used to work, her standard was to work 6 days a week and have 1 day off. And a lot of times in this hospital, because the patients are so sick, they used to have shortage of nurses. So they would ask her to do extra shifts. And so it wasn't uncommon for Jane to work. In addition to the 6 days a week that she always does, she will work sometimes 10 days in a row, be off for 1 day, 12 days in a row. 3 things that I have noticed as a problem. And I will just permit me to give you 3 simple solutions. The first issue that I've seen is number 1, procrastination. Procrastination. I'm talking to you and I'm talking to myself. You see, a few years ago, I myself, Dr. Omarine, I almost had an accident. Why? I was working a lot and I almost fell asleep at the wheel. When that maybe you need to see your doctor, maybe you need to get a mammogram, maybe you need to drink more water, maybe you need to exercise. Pause the program and go and do something small. Do it today and do it now. If you know you need to drink more water, pause this program, go and drink a glass of water. If you know you need to exercise, pause the program and do 3 jumps. You have exercised or walk in place. Don't hurt your knees. Walk in place for 1 minute. Problem number one is procrastination, and the solution is do it today, do it now. Problem number two is this: we do not prioritize our health. Why don't we prioritize our health? Because we feel fine. We feel fine. Jane has been a nurse for over 30 years. So, of course, she is aware of the signs of something wrong in her body. So, why didn't she seek help? That's because there are a lot of silent. You may have something brewing underneath. There are a lot of people who come into the emergency room with very, very high blood sugars, very, very high blood pressures, and they did not even know that they had hypertension. They did not know. So start prioritizing your health. I started prioritizing my health for the sake of my kids. So the problem number two, I said problem number one was procrastination. We do not prioritize and we do not personalize it. It could just be because you're not caring for yourself properly. I hope that this information helps someone out there. Again, you and I, as physicians, as nurses, as CNAs, as LVNs, should take better care of ourselves. And in this audio, I just want to give you some practical things.
So, Lovelace, this doctor is a friend to the late disease and also a colleague. So, she told us about the 3 P's. She said we should prioritize our time, we should personalize our time, and also to stop procrastinating. Yes, because with all these things she mentioned, all right, they are very deep. Oh. Some of us go say, I bet within this doctor they talk when she park well. Make your time personalize when it comes to your health issue. Not dey procrastinate say tomorrow I go do am. If you know that your body is feeling somehow and it's unusual, go rest. Anything you feel like to eat as at that time, go eat am. And no dey like make things not to dey bother you when it comes to your health matters. That is what she's trying to tell us here. All the summary for the 3 P's. Okay. So make we take our lives as priority. Not be only to dey find money or zubo. Na im be the thing. Because if e red, that money, another person go whack am. Yes, na our money will eventually turn to their money.
Our money, what our money, our money, what our money, our money. Oh, what our money, our money, African money. I got the top off, you get the top off, I got the top off, wow, 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 I got the top off. You get the top off, I got the top off, boom, boom, I got the top off, wow. On the money, African money, I got the top off, woman, they work, rich, they enjoy. I say, how we go bridge, the gap between account and the job.
So even bad family they chop. So when we talk about our personalization, okay, it's all about self-directed care. It's all about your well-being as an individual. So make we dey wise up because if it happen, it don't finish with that. They say there's no second chance if death don't knock for person door. And I will conclude with this, that there is careless death. Yes, now the one way Baba God not ordained, that is how we will pass out from planet Earth. So study your body and take it seriously. Goodbye for now.